I heard they're coming back.
Well, yeah. So again, there's some of it's marketing and some of it's science. And then there's anyway, there is a new FDA approved implant out. It's Motiva and it's nanotextured. So it's
The
not a
barely
smooth.
there textured.
Yeah, I know. All I can think of is condoms when I right? Ribbed for her pleasure.
Ribbed. Textured, spiky.
Do we need this? Okay, so they're nanotextured. I'm gonna wait on the sidelines. I just
see how it evolves.
Supposed to be softer. It's filling that need for that trend for subfascial augmentation. And it's not going to slide around as much. It just makes me a little nervous to go back to texture. So I was part of a panel at the national meeting where we talked about, it was a East Coast, West Coast breast trends. Talked about our augmentation. It was kind of funny. I was representing, San Diego, West Coast. But in part of that, pulled the studies or looked at research that had been done or published papers that looked at, what are the trends per region. And one of the things it looked at was like the incidence of silicone implants versus saline over the last, 15 to 20 years. And then the incidence of textured implants, again, over the last 15 or 20 years. And you can see where textured implants, the 410s by Allergan, got introduced. And then when all of a sudden then there was an FDA warning, and then they came off the market. And then you get to 2021, and in those surveys or studies, the use of textured implants went to zero. So no one's using textured implants. It got a very bad rap when Allergan recalled their textured implants. There's some subtlety in how implants are textured. So Allergan had a salt loss technique, which meant it was really textured, very bumpy, visibly textured. And so, of course, the FDA has a definition of what constitutes textured. And
if it's micro, it doesn't count.
Right. So up to a certain micron level, it doesn't count. So these are nanotextured, meaning that they're a little rough, but it's like different types of sandpaper. You have fine sandpaper and then you have coarse sandpaper. So coarse sandpaper we know is bad, can lead to ALCL. Fine sandpaper is there to fill the gap because all we have is smooth right now. So, if I need to paint my house, I guess, no, I'm just kidding. I don't know. I don't have a need for
You'll be taking out all these implants in a couple of years.
I know. Nothing pisses me off more than taking out textured implants, honestly. Because of the controversy surrounding ALCL, again, the science shows that you don't have to have your implants removed, but you just have to watch them carefully. But people often are like, okay, well, that makes me nervous, take them out. And then the few cases of ALCL that showed up when people had smooth implants in place, they had a history of textured implants or expanders prior. So the treatment for ALCL is taking out that entire capsule and block. So when I see somebody who has a textured implant, I explain all of this to them. And I was like, listen, if it was me, I would take out the whole capsule. Then your risk is, hopefully as you're not zero, but it's as reduced as possible, because we know that even having that capsule in there after you've had a textured implant, we're removing the implant, but we haven't removed the capsule. So let's take the whole capsule out. And as you know, taking the whole capsule out is definitely more invasive, longer surgery.
I'm definitely absent on those days.
Those are the days you call in.
Right. Sir, I'm sick. So it's so much fun.
Yeah, it's just a lot of work and you're like, I don't know. It's just a lot of work. And like I said, versus just taking an implant out and putting another one in, the patient's going to wake up in a lot less pain, a lot less discomfort, especially submuscular. It's sitting on the chest wall. So taking out textured implants is kind of one of my least favorite things to do, but we do it.
That capsule is stuck. Let me tell you, it is stuck down.
Yeah.
It is.
It also is a risk for getting double capsules where the capsule, it's just So anyway, not a fan of taking out textured implants. So I just don't think I can honestly put them in currently, even if it's nanotextured. It makes me cringe
Right.
a little. But we'll see. Maybe, they are softer. They're kind of a velvety finish. Like if somebody came in and requested it, I'd probably think about doing it. But I'm not, that's not going to be my marketing strategy is to offer this new implant.
Right.
I'm okay with the ones we have.